Okay. All right. So the goal of the clinical and systems transformation project is to improve the safety, quality, and consistency of patient care through LVCH, PHSA, and PHC. We're trying to configure for an enterprise design, which means that the design elements are standardized and similar across all sites. And we aim for a connected health system that works for patients and the people who care for them. Our project drivers include the following: patient safety first, best way every day, FaceTime, not chase time, and draw on data. And the purpose of this session is to provide SMEs the opportunity to review enterprise workflow applicable to the Richmond bronchoscopy and endoscopy, and also to identify new design requirements and address gaps to satisfy the workflow. So here are the standardized terminology, and you're going to hear some of these come up during the session today. So I'll hand it over to Tammy now.
Thank you, Tommy. So here I'll continue on with the day of procedure registration workflow. There will be another overview sessions on scheduling for endoscopy and bronchoscopy, so more details will be provided there. On the day of the procedure, when the patient arrives, the admitting clerk at the hospital will register the patient into the system. So here for prior to the day of the procedure, the MOA from the office will fax the surgical booking packages and the slates to endoscopy booking clerk. This includes the consent, the MOST form, and the endoscopy booking form. And the endoscopy booking clerk from the hospitals will now associate the surgical booking packages to electronic patient records from the work queue monitor. And this will also create the pre-day surgery encounter for the patient's surgical booking packages to be attached to, and will schedule the appointments. The appointment type will be endoscopy appointment type in the scheduling appointment book. And then if it's in an inpatient, if it's for an inpatient scheduling, it'll be scheduled on a current inpatient counter. So on the day of the procedure, this is the registration process. The patient will arrive to the hospital at the admitting area. The admitting clerk will now register the patient. The pre-day surgery encounter created by the booking clerk will now be flipped to the active day surgery encounter. And the patient's chartlets, which is the mini version of the patient's paper chart, will be created. This will encompass the patient's demographic sheets, the wristbands, any patient's ID labels. When the patient arrives to the endoscopy unit, the nursing unit clerk will now confirm the patient's ID and the right information for discharge. And also it will update the patient's status and the perioperative tracking shelves to show the patient's now in the waiting room. This will communicate to the pre-op nurse that now the patient's now available to be brought into the pre-op space. So now continue on with the nursing workflow. This is now in the pre-op area for the pre-op nurse for the endoscopy and bronchoscopy. So this is the general workflow for the pre-op nurse listed as follow. First of all, the patient status is now in pre-op, so it will be shown on the peri-op tracking shelf. The nurse will now complete the bed transfer to show that the patient's location is updated on the Cerner chart. The interview process will be guided by two power forms, endoscopy assessment and the peri-op pre-procedure checklist. Depending on the procedures, the GI endoscopy will be encompassing with the multi-phase GI multi-phase endoscopy power form, sorry. And then from the bronchoscopy, it'll be the REVS pulmonary interventional multi-phase power plan. So for these power plans, the pre-op nurse will initiate the pre-procedure phase. For documentation such as vital signs, pain assessments, peripheral IVs insertions, that will be taking place in the interactive view for INO. So this is the equivalent of flow sheets. There is a band for endoscopy. So this is the endo quick view segment. So it has more information for endoscopy patients. For medications, IV fluids required for the pre-op phase. It'll be done through medication administration wizards. Once the patient is completed for the pre-op phase, the pre-op nurse will update the status on the peri-op tracking shelf to show that the patient is now ready for surgery. Now I'll go through the demo process. Share my screen. All right. Can you see my screen for the
Yep.
All good. All right. So here we are. This is the perioperative tracking shell. This is when you log into Power Chart. Just to have a brief overview. So up here is the gray toolbar. You can see many buttons for the functions of CST and the chart. Here we have some arrows here. You can add and remove button for customizations. And here we have these tabs. So these are the location tabs to show different locations, units to add, and this is how you can add different locations depending on where you want to view into the units. Once we click into the tab that we want to look for the patients, today we'll be demoing in the BGH Data tab. This shows the patient list or the census or the slates for the day. Okay, so here we see our patients. This is our test patient here. This bar here, that's the patient's chart. So you can see many of the important status regarding the patients. Patients now in waiting room, as we said in the scenario, they are in the day surgery encounter. This is the patient's name. There is allergy documented for this patient, the age, procedures, providers. There's also additional free text space here for if there's any communications required. Another brief overview of this page here, we have the refresh button. So we do want to refresh this the chart frequently because there will be other clinicians accessing the chart at the same time. So we just want to make sure it's most up to date. Here we have the resend button, so you can quickly go back to see other patients that you've been looking up so that you don't have to keep looking up the patients from start. All right, so now we have the patients here. Once we click here, this is how we can access the patient's chart. I'm gonna double click. And this is the pop-up window for assigning a relationship. Today, I am going to check in the patients as a nurse. And this patient, this relationship will last for 13 hours. Like, okay. Here, it'll bring us into the patient's chart. This is the perioperative summary page, and you can see all the key informations about the patients here. This is a menu bar, so you can access it through to check into the different sections of the patient's chart. So to make sure, and also this is the patient's banner bar. So again, you can see the patient's name, the allergy status, the demographics data, and the location. So now we want to update the patient's location to make sure they are in the right place. So to do so, we're going to go to PM conversation, patient management conversation, and there's the bed transfer function. Click onto it, wait for it to load. All right, so here it'll bring us to this pop-up window. It is auto-populated already, so that's good. So now we want to go to the new location. So we're still in BGH. We're gonna go to GH endoscopy. I'm gonna go to procedure room. No bed available. So this is for just for demo purposes. So we'll put in the date. So here for transfer date, it will be today. So we can T, and then transfer time will be now. Now let's try complete. This cannot be completed because we don't have an available bed, but in reality, there will be a bed available for the patients. So once it's updated, then you can click complete and it will show it on the day bed. All right, next, we want to update the patient status on the peri-op tracking shell to show that they're now in the pre-op space. So now we can go back to the peri-op tracking in the toolbar here, and we can update this status. To do so, we go to set events. Now we're in the pre-op tab, and to show that now the patient is ready in pre-op, we can update here. Now the patient is in pre-op space. Now we can do our check-in process. We're going to go back to the patient's chart, and we're going to pull up some forms. So for to pull the 2 PAR forms, we can go to AgHub. So for PAR forms, that's the equivalent of the paper-based forms that we use when we do the check-in process for the patients. For endoscopy, we use the endoscopy assessments, and also the perioperative pre-procedure checklist. Charting here. So this will open up the forms. So this will be the patient's preparations for the checklist. The procedure location will be endoscopy. Last food and fluid intake, there will be yes. So for here, you'll see all these yellow highlighted sections and Cerner. That means these are required sections to be filled out. So last fluid intake, we can mention the date. That'll be yesterday. And then we can put now, maybe we can put it to 2 hours before. Last fluid intake, same, that'll be last night. And then we can put it to Excel. And then it'll be clear fluids. So you have a lot of space here for documentations. It all depends on the unit's practice and also depending on the patient's conditions. So here, if it's the patient's diabetic, so you can document their sugars levels here as well. On here, you can see the red asterisks. So again, these are required sections. Once it's complete, then you can see the check mark here. And then now we go with this one here. So these are all the required field. We can have to verify the patient's ID band. The allergy band is now verified with the patients, and also the COVID screening form, depending on the site's protocol. Depending on the site's practice, to check the surgical consent, this part will be reviewed as well. So once it's done, these check mark will appear. So patient's valuables, belongings, we can say no. And that's about it for here. So to finalize the form or to sign the form, we can click on the check mark. Okay. And once the form is completed, then it will be, you can access the form in the form browser or through documentation. So form browser is here to look up past forms and documentations. Let's see, there's the checklist completed. And next we have to go to do the endoscopy. So this is another PAR forms. Again, you can see these are the required sections. You can go through it as based on your unit's practice for the other sections. So information given by, you can say by patient, surgery, procedure date, review, discharge contact names for the ride information, all those things. You can document vital signs for your pre-op assessments. There's also more patient screening histories. For medications history, the staff now needs the Prime account to go through medication reconciliation. This is also patient's instructions for before day of surgery, and also if there's any site practices. This part here will be required. So here we can say it's no for the patients. And patients also doesn't have these conditions. Scroll down to the list. Have you been outside? You can say no for the patients. And once those yellow fields are completed, you can see the check mark here. Same for violence and aggression screening. We can say there's no risk assessed for the patient at this moment. And go down. Not available, no violence risk assessed. And you can see the check mark. Continue on for the sections here. We have this pain assessment tool. We have the fall risk assessment for the patients, social histories, including activities, tobaccos, alcohol use, substance use, if they have a preference for gender and pronouns, all these categories. Procedure history, if there's any previous procedures done on the patients, family history, and all the other sections. Okay, so let's finalize this one. And now you can see it's populated in, let's refresh this first, here. So you now can see the forms are available on form browsers and also in the documentation section. Two of these forms. All right, so now we're done with our check-in process. So depending on if we need to set up any process alert for the patients from your interview, then you can go back to the peri-op tracking shelf and we can go to PM here. And this is to set up any process alert. Process alert means that if, let's say, the patient is identified to have violence risks or seizures precautions, then you can add it to the patient's banner bar. Here we can look up.
Tammy, there should be one said the VGH Vancouver General Hospital, so VGHV.
Oh, okay, VGH. Sorry.
Yep, and you can type in space and just type in Vancouver.
Oh, perfect. Thank you.
Yeah.
Thank you. All right. Sorry. Okay, so this is the process alert. Here we can double click, and here you can see all these here. So identify that this is the right patients for our patients, and these are all the process alerts that we can flag up for the patients. So seizures precautions, violence risks, all these things. But we have not identified any of these process alerts on this patient, so we don't have to complete. All right, so let's go back. We're now continuing on initiating orders for the pre-op space. So for orders, we can go to the order sections on the menu. So you can see all the orders here, depending on the plans. In CST Cerners, we call the PAR plans, which is the equivalence of the pre-printed orders in paper forms. Depending on the patient's procedures, we have GI endoscopy multi-phase PAR forms, or for bronchoscopy, we have RAF's pulmonary interventional multi-phase. Multi-phase meaning it encompasses both the pre-procedure phase and the post-procedure phase. Today, our patients in GI endoscopy, and I'm the pre-op nurse. I'm gonna go here, review the orders required for the pre-procedure phase. These are planned. These are plan orders. So these are placed ahead of time. And once the patient is in the right phase, it will be initiated. So here we have to take vital signs. The patient is required for IV insertions and also for sodium chloride for continuous infusions. I'm the pre-op nurse. I'm going to initiate right now. Orders for signatures. All right, so once the order is initiated, I can now go to look at the medications. This is for medication administrations, we have the MAR here to show all the listed medications required. Here it says pending. Pending means it hasn't been given or administered. To administer medications, we're gonna go to Medication Administration Wizard. Here, I will take you through the prompts. In CST Cerners, we're using closed loop medication administrations. So the process requires scanning the patient's wristband with a barcode and then scanning the medication's barcode if it's available. For NS, that's a store item. So there's no barcode on the IV fluid bag. So we won't be scanning that one, but we'll go through the prompts. So we'll scan the patient's wristband. And then here it will show you the medication list required. So here we're going to check into here. And because there's no medication to scan, and there's okay.
Oh, can you click on the yellow field?
Oh yes. Oh yes. Sorry.
Thank you.
Yeah. Here we have to continue with the charting. So I'm the nurse. I'm gonna administer at this time. There's one bag and the site will be, let's say I inserted the IV on the left lower arm, volume and rate as set. And fine. And now it's completed. All right, so that's all the medications I'm required to give at the pre-op phase. Next, I'm gonna start charting patients' assessments. So for patients charting in the flow sheets, before Cerner, it'll be in the flow sheets paper forms. Here in Cerners, we have interactive view and INO. You can see all these sections. These are for different type of flow sheets. For endoscopy, we have the endoscopy quick view. So these are all the pertaining sections for endoscopy patients, including vital signs. So these one here will be pulled in if it's available from the PAR forms. I've inserted IVs here, so we can also chart here. This little buttons means it's a dynamic group. So when you click into it, it will show you a clusters of information that we can use to chart regarding the IV. So let's say I inserted a short peripheral IVs in the patients, and it's in the forearm, but it's on the left side. Let's say I put in a 20 gauge. And then you can keep documenting if it's according to the site's practice. Other areas, so there's the discharge criteria once the patient's ready for discharge, pain assessments for the patients, assessments, if there's a urinary catheters, and there's another place to document blood sugar levels. If there's restraint informations, providers informations, and the false risks. All right, so I think that takes us to the end of the check-in process. So once the check-in process is complete for the patients, and I want to now communicate to the operating room nurse that the patient is now ready for the procedures, I will now go back to the peri-op tracking shell, and I'll have to update this status by going through set events. And now we can say the patient is now ready for surgery and update it on the tracking shell. Okay. Any questions so far? All right, so if there's none, thank you so much. And now Tommy will take you through to the next phase of the patient's journey.
Well, thank you, Tammy. That was a great overview. I'm just going to share my screen again. Okay. So next we're going over our intra-op workflow. So first is to transfer the patient to an endo room, and then we're going to review the assessment form, consent form, and we're going to go over the checklist again quickly. For an endoscopy, we want to discontinue the GI pre-op orders and initiate the procedural sedation orders. And for bronch, we want to discontinue the bronch pre-op orders and initiate the intra-op orders. And next, we're going to create a sedation record by launching the surgeon anesthesia application, and then we're going to associate the monitors. After that, we're going to check in the patient via the peri-op doc, the intra-op record, document the intra-op record, finalize that, document the assay, and finalize that. And then finally, we're going to label our specimen as necessary. Okay, so I'm just going to demo that as well. Okay. Are you guys seeing my tracking board okay?
Yeah, we can see.
Yes, we do.
Okay, perfect. Thank you. All right. So now under the status, it'll say patient ready for surgery. And just want to double check the name, make sure we are getting the right patient. And again, we are going to double click on that to establish a relationship. And the first thing we're going to do is to do a bed transfer by going to our PM conversation. That takes a while to load. Okay, and then we're going to select VGH endo. And then we're going to select a bed. I'm going to pick number 2. This is 30, but that is fine. And then the room and bed number will be pre-filled. And then the transfer day, I'm just going to say it's today. And then the time is now. So if I refresh, the location will be updated in the banner bar. Okay, so next we're going to review our endo assessment form real quick. So you go to the document section, and then you bring up this text rendition. It's kind of hard to read. So what you can do is to click on this modify icon, and then it'll bring you back to the Power Form version. And you can make any edits to this, but you don't have to. Just gonna exit for now. Exit. And next, we want to make sure there's a consent form. So usually the consent form is part of the booking package. So this is a pretend booking package. It's got a consent form there. So I'm going to exit. And next, we're going to go to our peri-op pre-procedure checklist. And again, we're going to click on the modify icon. And we're going to review the checklist. And then you want to scroll down. And then click on this review by OR nurse radio button. And then on the second page, So now we've reviewed our consent. We're gonna go ahead and click yes, procedure consent complete. And then we're gonna scroll down again. You wanna click on the review by OR nurse. And that's it for the checklist. So now we just wanna sign. And every time you modify something, you'll say document has been revised, and then it has your name here. Okay. So next is order hygiene. So I want to go to our orders. So we always want to discontinue the previous phase and then initiate the current phase. So right click and discontinue the previous phase. If there's anything you want to keep, you can click on these. But for today, we're not going to keep anything. So to discontinue anything, you don't need any co-signature. Okay, and then we're going to initiate our GI procedural sedation phase, so we get our medications. And because it's already put in by the physician, we don't need a co-signature either. So you can just click through. And then if you refresh, and then you'll have our medications. Okay, so next we want to create our sedation record. So we're going to launch the surgeon anesthesia app. So in the real environment, the power chart and SA will be available in the launch bar up top. So we're going to select a case. So just make sure the surgical area is correct. And make sure you select the correct patient as well. So we're gonna go okay here. Double check that's our patient. And for Richmond, there should be a tab dedicated to the Richmond ambulatory space. But for now, I'm just going to pick VGH main OR. Okay. And the start time, this is kind of important because we want to make sure the patient does not enter the room before any staff. So you can adjust this accordingly. Okay, and because we initiated our procedural sedation order, our medications are available. So we just want to click continue and go okay. Okay, so this is what a sedation record looks like. You have these to-do list, and then we have in a real life, there's these monitors here, and then this is the vital sign graphing, and we also have our activity pane down here that will show you the staff in-room time, the procedure start, stop, that kind of thing. So the first thing we want to do is to go to our macros. So macros is just a set of predefined events and actions that will run automatically. So for endo, we want to click on the endo sedation with orders, and anything under the execute, any items under execute will flow to the chart right away. Anything under to do will kind of sit on a reminder list. I'm just going to deselect these because these won't be available in the live version. Okay, so I'm going to go ahead with the execute, and you see all these monitors here, and then you'll start to pull in vitals once the patient is hooked up to the monitor every 5 minutes or so, and then you can do your NEPCON, your ECG there. And next, we're going to go to our personnel because we want to put in our staff. So whoever opens the sedation record will be here already. So now we just need to find a surgeon. I'm just going to click on the random surgeon here. And then I'm going to add another nurse. Okay, And you can adjust the time accordingly as well. Okay, so now we have our macro up here, and then we have all our personnel down here in the action pane. So next we're going to our ASA class. So just going to click on the plus button. And we're going to say it's ASA 2. And anesthesia type, usually during the booking process, a clerk will put in the anesthesia type. Is mostly procedural sedation. So if it's already done in booking, you don't have to change this. It will default to that. Any questions so far? Okay. So now the patient's in the room, we want to kind of check the patient in. So while the other nurse is hooking the patient up, we can go to our peri-op doc. And we want to open our intra-op record. And just double check this is the correct patient. And once you open up an intra-op record, if you go back to the tracking, I'm just going to refresh this. You'll see this check-in mark. That means the patient is actually in the room physically. Okay, so these 4 segments are the mandatory ones as indicated by the red exclamation mark. And depending on the procedure, there are other segments. I'm just going to add a few. And these other segments are based on the procedures, different procedures, bronchoscopy, colonoscopy, EGD, they all have different segments. So now the patient's in the room, we just want to go to case time and want to say, okay, the patient's in the room, and the time here will update, will flow to SA as well. Okay. But unfortunately, the personnel in SA will not flow into Power Chart. So we kind of have to add them again. But whoever attending is assigned to the patient will already be entered. So I'm just going to add a test nurse. Okay, and the role perform, I'm going to say it's an endo nurse. And then we're going to add, going to click add, and I'm going to add another nurse because there should be 2 nurses in the room. Okay, I'll add that one as well. Okay, and we just want to verify our general case data here. In the live environment, the specialty should be defaulted. If it's a colonoscopy, it should default to gastroenterology. And then we want to verify our procedure as well. If the surgical service is not entered, we want to make sure it is entered. And our anesthesia type. So anything with a kind of gray box is mandatory. Oh, and then anytime you modify something, you want to click modify, but it'll prompt you. Yes. Okay. So now before we go back to SA, we should do our briefing. And then this is where you enter the scope number. So I'm just gonna say it's that. If you click add, you will have that available to you. Okay. So now the procedure is ready to get started, and the physician wants to give some medication. So we want to go back to our SA. So before we give them any medication, we should document our medcons here. And document this according to the unit policy For VGH, they do the pain intensity, they do the level of consciousness, and then they document their ECG as well. Okay, and the vitals will flow in here every 5 minutes. So to give a medication, let's say we want to give 3 of Midas and 50 of fentanyl. So we right click on the fentanyl, we click on edit, and then we say 50 microgram of fentanyl, and you'll see this new here. That means it's a new dose. So if you click execute, it'll flow right away. If you click OK, you'll go back to the to-do list. So we'll do the same thing for midazolam. We'll do 3. And if you made a mistake, you can always go back to change it. You can just click on the circle there and then to change your medication. And if you want to add more, you can do that too. So just click on the name of the medication. You'll always default to the dose you gave before, but for this time, I just want to give 25. And then you'll see it's 50, 25, this is the total amount. And let's say I want to give something that's not in the to-do list. I can go to document. I'll make sure you are on the medication tab, and we're going to select all. So all the medications are available to us. So just highlight any medication, and then you can start typing. So I just want to give some Buscopan. So I double click on that, and then I'm going to give 10 milligram. I'll say, okay. So that's our documentation for medication. So now the procedure has started. We want to go back to our the power chart. Okay, so we want to go to our case time, start the procedure, and all these times will flow into SA. Just go back to SA here. It takes a little bit of time. I'll come back, it'll show up. Okay, so let's say the doctor wants to take a biopsy. So what we want to do is to go to our endo procedure, and we want to select on our colonoscopy procedure in the multi-entry box, and we want to go to the drop down, or you can type it in as well. We're going to say with biopsy, I'll change to that, and then we're going to select modify, and it'll ask you to dissociate from the previous procedure. You just go okay. And some of the segments will change depending on what procedure you change it to, but all the information you entered will be saved already. Okay, so now the procedure is colonoscopy with biopsy. And next is our culture and specimen. So under specimen order, we want to click yes, specimen type. There are a couple types for you to choose from. Biopsy is a pathology, so we're going to select that. And we're just going to say 1 for now. We're going to say it's a right colon biopsy. And you can always go back to edit this. And once you're done, you just add. And then if there are 2 biopsy, you can go back and then change that. So this is not a requisition. This is just to document that you've taken any biopsy in the intra-op record. So after the procedure, the physicians will print a pathology requisition. Now, alternatively, nursing also have that access. So to do that, we want to go to our peri-op summary. And we want to go to quick orders, and under the intra-op component, there's the surgical specimen, just find pathology surgical request. And this requisition is a verbal order, so we want to select that. Okay, and you see this shopping cart here, so you just click on that. You don't need to modify any details. In here, you can just sign, and you'll just print out to the assigned printer. And that is it for specimen. Okay, so now the procedure has completed. We want to go back to our case time to enter our stop time. And just for the sake of the demo, I'm going to say the out of room time is 5 minutes from now. And all these times will auto update. So if you click on the case attendee and just click somewhere else, you'll update the case attendee. And now you have a green check mark. Same for endoscopy procedure because we're missing a stop time. So you click on that, you click on wait, and then we're done. And now we want to do our debriefing. You can put in the time if you want. It's up to the unit policy. Okay, so now everything's green. We can go ahead and finalize. I'm not sure if Richmond will use the pick list, but we can talk about that later. I'm just going to go over this real quick so we can finalize. Okay. All right, and there is your intra-op record. And to discharge patient from one-to-one monitoring, we want to go to our iView. And then we want to find our endoscopy quick view band again. We want to go to our sedation scale. And for the out of 10 discharge criteria, we want to select the modified Aldrete score. We just want to score the patient. We'll say the patient is a little bit sleepy. So the score is 9, so we can sign that one. Okay, so that's it from the power chart side. So now we want to go back to our essay to finalize that. Okay, so all the time should pull over here in the real environment. Okay. So we want to finalize our case. The little button up here in the toolbar. Want to go okay. And we just want to sign. And then the record will go away. And that's it for the intra-op. Let me see if I'm missing anything. Is there any question? I know it's a lot to click, but the staff will become very good at it after a couple weeks. Okay, so we'll go back to our PowerPoint. We can take a little break, 5 minutes break. We can come back at 9:30. I think we can get started again. It's 9:30. Okay, and I'll hand it over to Winnie for the post-op portion.
Perfect. Thanks, Tommy. I'm just going to share my screen. Give me 1 second. Oh, sorry. Actually, you're not going to do that. I'll just quickly run through what a post-op nurse will do in the workflow. So what we're going to do is we're going to complete the bed transfer for the patient into the day bed. We'll review the intra-op and sedation record. We'll document their arrival to phase 2, and then we'll discontinue the appropriate power plans and then initiate the post-op ones. I just want to highlight for bronchoscopy that post-bronchoscopy patients, the daybed nurse does not initiate the post-op orders. The provider is to initiate the post-op orders so they can order the appropriate lab requisitions for the samples. So then we'll associate our device for our vital signs, and then we'll document all our nursing duties, tasks, any intake and output, and then discharge criteria. Is there another slide to this, or just this one slide?
Yes.
So then we'll complete the discharge checklist, and then we'll discontinue the appropriate post-op orders, document and finalize our patient's departure from phase 2, and then finally we'll discharge the encounter.
Okay.
So I'll just share my screen now. Okay, so we have our patient that's coming out from the procedure into daybed, and we'll see here that the patient is out of the room. So I'll click into the chart here, and I'll establish my relationship with the patient. Perfect. So the chart's open. I'm going to bed transfer the patient from their procedure bed into the daybed post-op space. Make this a bit bigger, easier to see. So I'll use the VGH daybed, and we will find this bed here. And I'm going to transfer the patient now, today and now, and I'll complete the transfer. So if I hit refresh, I'll see in the top right corner here, it says that the patient is now in daybed in this specific bed that I put them in. And then I'll head down to documentation here. I just want to review what's been done in the procedure. And this was a filter here that was applied. I want to see all notes here. So we'll see the sedation record. So I'll click into here, and we'll see the sedation record that was performed by Tommy intra-op. So the patient got 75 of fentanyl and 3 of midaz and 10 of ascopan. And then you can also review the intra-op documentation here. So who was in the case, when it started, when it finished, what procedure was done, etc. Okay. So what I'll do is, now that the patient's here, I'll have to document that they're in phase 2. So on the left-hand side here, I'll click peri-op doc, and I'll document that they're going to be in a phase 2. Okay. And three places to document here. So we'll document their arrival. I'll click this time here, and it auto-populates the current time. And then we'll leave the other 2 blank. The patient's not met criteria yet, and they're not going to leave phase 2 yet, and I'll hit next. So I just want to show, when we update the times here on the arrival to phase 2, if you go back to perioperative tracking and you hit refresh, it shows on the tracking board here that the patient's in phase 2. So it's just a good communication tool for everybody so they know what phase the patient's in. Great. So then I will go to my orders, and the patient is finished their procedure. So this procedural sedation module is the endoscopy intra-op. So what I'm going to do is I'm going to discontinue it. And it just prompts me to make sure to review what I'm discontinuing. I don't need any of these, so I'll hit OK. Type in the physician, no co-signature. I'll just review this one more time and confirm that these are the orders I'm discontinuing, and then I'll sign for them. Great. I'll hit refresh, and then you'll see right here that this module has been discontinued. And then I'm going to go to the planned post-procedure part of the power plan and hit initiate now. Once again, no code of signature is required because the physician's already planned these orders. And I only want to see the orders that the doctor wants us to do. So these are the orders here: discharge patient, do vitals, sedation assessment, remove their IV. Happy with that. I'll hit orders for signature. And once again, I'll sign the orders, hit refresh again, and then we'll see that now this is initiated and these are the orders that I'm to carry out in post-op. So I just want to highlight again, for patients that are going under bronchoscopy for post-procedure, the nurse is not to initiate the post-procedure. The physician will do that because they have to order the associated test with the samples. So we, as post-op nurses in daybed for bronch, they will not be initiating the post, but you should still discontinue the intra power plan. Okay, so I'd like to start with some vital signs for my patient. Tommy highlighted this earlier, but I'll highlight again. This little cell phone looking icon is where we would associate our device, so like our vitals machine, so that when your patient's vitals are being done, they can just pull into iView directly here without you having to document them. Obviously, I don't have a real live monitor here, so I'm just going to document some vitals quickly. So a temperature, a blood pressure, rest rate. If they're on any oxygen, you would highlight that here. If they're coming off of oxygen from the procedure, it would be ongoing. And then if they're on any oxygen, you would say, by nasal cannula, what have you, like 2 liters. And then you could chart that part by just hitting the green check mark. And then something else we'll also chart is their sedation scale. So now that they're done procedure, we want to use the same sedation scale tool, and we'll want to see, are they able to meet all these criteria? Well, they're technically on oxygen. So you'll see that there's a blue text here, and what this blue text is just, if you click into it, it just gives you more information about what the field is asking for. So if you want a reference point, you can click that and be able to see what you're charting on. And there's a little calculator button. It just shows you that this is going to be a calculated value based on the responses that you've given previously. Okay. Once the text is black, it means you've signed for it. Before you click the check mark, it's purple, which means you can still edit it, just in case you're wondering about the difference. Okay, and something else I'd like to chart on. I want to chart on their pain. If you have, if they have pain, you would chart that here. If they don't, you would also chart that here. Any associated pain tools you used. If you need any extra information, this text is blue for you to click into. I'm going to chart that they have no pain. And gastrointestinal nausea level, I'm going to say they have none. There's also this area here that says post-procedure patient discussion. So whether or not the patient expresses concern post-procedure, I'm going to say no. And I'll sign for that as well. If there was any fluids given intra-op, you would also document that in here as well. And if the patient's going to be discharged and their IV is going to be removed, you would document that here in peripheral IV as well. So I'm going to say that the patient's met discharge criteria for phase 2. I'll hit next. And I'm just going to see if this updates in perioperative tracking as it should. So the patient's met criteria, now it'll say ready for discharge. Click back in here. And we will also send them home. So you can say they're exiting phase 2 at this time. Hit next. Now everything is green. We will sign for that. No deficits, excellent. And then just a short little record, just similar to the intra-op record that you'll see here with the associated times that we put in. So when we're about to send patients home, we'll go to ad hoc. We want to do a discharge checklist. So ad hoc is where we get kind of all our flow sheets per se. We'll go into endo and then we'll hit discharge checklist here and we'll chart on that. So if there's any follow-up information that's required or discharge education provided, you just go through the list. I'll say there's no follow-up, no summary, no prescriptions. Patients make transportation arrangements, no follow-up. And then just to remember to scroll down here, there's one more that says patient expresses concern post-procedure. No, they're accompanied by, let's say they're accompanied by their spouse and they're going home in a private personal vehicle. Any associated discharge comments you want to mention here, you can also document that in this free text box. Then we'll hit check mark. If you want to review that again, you can go to documentation and you'll see that what we just documented here is just summarized here in case you need to review it. And patient's gonna go home. They've gone home. So what we're gonna do is now discharge the encounter. So we will go to discharge encounter here under PM conversation. I'll just blow this up a little bit bigger. Discharge disposition. We'll click these yellow boxes here. Discharge home without support services is what I'm going to pick. And we're discharging today and discharging them now. And I'll hit complete. And I'll hit refresh. And you'll see in the top right here, just before I discharged them, it said day surgery active. But now you'll see that the status is reflected and now they've been discharged. So yeah, that's the part of my demonstration. I just want to see if there's any questions, anything we can clarify for you guys, just let us know.
Thank you, Winnie. So I'm going to share my slide again. Okay. So is there any question from the Richmond Smiths for us? If not, we have questions for you guys.
Hi, it's Mary. Not at the moment.
Okay,
But yeah,
great. Thank you,
sure.
Mary.
Ron is on the line. I'm not sure if there's any nursing questions, but I think the overview was pretty straightforward.
Okay,
Thank
great.
you.
Thank you.
Hi, it's Ron here.
Hey,
Can you hear
Ron.
me?
Yes.
Oh yeah, I was just wondering, sometimes we use things like Elaview, normal saline stuff to raise polyps. Would that be
Yep.
populated in the medication?
Those are right. Those are actually in the intra-op record in one of
Okay.
the sections. So you document those in the intra-op record.
Okay,
Yeah.
all right, thank you.
No problem. Okay, so is there anything that deviates from the Richmond workflow for endo and bronch, or are they pretty enterprise like what we just showed you guys?
Yeah, it's pretty similar.
Okay, perfect. Very good.
Thanks.
Thank you. And in terms of the booking packages, what do you guys put in there? Does it have the booking form, the consent, and the most form? Anything else?
Yeah, so on our booking packages, it comes with the also the patient questionnaire.
Oh, okay,
It's
okay.
the same as the questionnaire, the surgical.
The assessment form?
Yeah, no, it's
Oh.
a questionnaire for patients to answer
Oh,
any health issues. That comes standard in the surgeon's packages. Now, we also
Okay.
have gastroenterology, and normally they do direct to scope. So when they do direct to scope, we end up getting the patient to fill it out in the waiting area. So
I
the
see.
admitted nurse then has that for reference when they admit the patient. So not
Okay.
all packages come standard with that, but it is a requirement we ask for our nurses to have for admitting purposes.
Okay, I see.
Mhm.
So I wonder if we have those form
Tommy, I actually wonder if that's what we had discussed in the crosswalk.
Yeah,
What would be replaced in Cerner by the endo assessment? The
right,
the part with the multiple systems
okay,
assessment.
okay. Maybe we'll just confirm that with Mary later on. We can email Mary the assessment form just to make sure that's the one.
Yeah, and can you also CC Ron as well?
Ron, okay,
I just want to
perfect.
make sure that the clinical questions are correct on there. so
Yeah,
We can compare with what we get from clerical side.
okay, yeah, we just want to make sure all the forms are available.
Mhm.
Okay, thank you. And
You're
then we have a question about the RT's responsibility during the bronchoscopy. We understand that the RTs do the freezing part and then they collect specimens. Do they do anything else in terms of scheduling or giving any sedation, things like that?
No sedation
Okay,
or scheduling from as far as I know.
okay, perfect. So just like the freezing and setting up the scope and then the collecting the specimen.
Yeah, that's correct.
Okay, perfect. Thank you. And another question is regarding the pre and post procedure beds. Do you name them those beds day beds or is there another name?
No, we just go by the numbers.
Okay,
You know, bed 1, bed 2, etc.
okay. But what is the location called?
Recovery.
Okay, like ambulatory care, prep and recovery?
Well, we never use the term ambulatory care because we have so
okay.
many different clinics, but we just say recovery.
Sure, okay. And do you share those beds with other services like cystoscopy, colposcopy?
No, unless there is some sort of adverse event and we need a space.
Oh, so those are dedicated to bronch and endo.
Yeah, primarily bronch and endo, yes.
Okay. And so cystoscopy and colposcopy, do they have their own beds in a different area?
Usually they don't require beds.
Oh,
Mhm.
I see. Okay, okay. So those are beds. Those beds are for you guys. Okay. And we have a question from the lab folks. We just want to confirm for blood work, do you call the lab to collect?
Sorry, is that for us or?
Yes.
Yes, we do. Yes.
Okay, okay.
Hi, this is Rana. I'm a CIS with the lab. So just a follow-up question. Are these the same day orders or are these orders that were placed, lab orders placed ahead of time?
They're usually same day orders.
Okay. And I guess I'm trying to understand whether these are things that can be done in the outpatient clinic. So what is preventing the patient from doing them ahead of time?
Usually the doctor, I guess.
So it's just the doctor is not placing the orders.
Well, not all. It depends on who's writing the orders and what they want. You see.
So these are tests that can be done ahead of time and will be valid the day of procedure.
I'm
Sorry,
not sure if I can understand that. Sorry.
Okay.
Sorry, Rana.
Mhm.
Well, all our patients don't actually require blood work prior to having their scope done.
Okay.
Well,
If there is anything needed from the lab previously to being consulted by the specialist, they do that on their own time. It's more the patients that have like maybe a code blue or someone that they found recent findings that they need to be admitted to the hospital. Then on the day of procedure, then those lab tests get ordered
done,
by the specialist. But for requirement purposes, we don't need patients to have blood work prior to endoscopy or bronchoscopy. Just is that what you're asking, Rana?
Yes,
Okay.
thank you. So like it's only urgent, clinically urgent blood collection.
If it's something that's required by the day of the surgeon or the endoscopist that does the procedure.
Thank you. And Mary, would you say these are frequent, meaning would you need an MLA every morning for those procedures, or these are like ad hoc?
From what I understand from clerical, because the unit clerk would be the one ordering the lab. As I recall, it's not as common, but maybe Ron, if that's something that you can back up by saying if it is common or not common, if it's changed, but I don't remember being something regular.
Well, sorry, when you mean the clerk ordering the labs, I mean, like, for example, Dr. Kleiber she's the only one that actually orders any labs for bronch patients, really.
Yeah, so if
And,
Dr. Clever, yeah, she orders it, then we just give it to Debbie or Sylvia. And then
yes,
they
and they will
Yeah.
they will do the rest, yes.
so it'd be morely bronchoscopy versus endoscopy, right?
Mhm.
That's more
Yes,
common.
that's right. Mhm.
Okay, and sorry, just to go back, when you say they're common, again, is that particular physician like
Yeah,
all their
she
patients?
always she always orders labs for her patients post procedure.
Correct.
Post procedure, and those
Yes.
are the ones that the lab would come and collect from the clinic.
Yes, that's right.
Okay.
Correct.
Okay.
Mhm.
Okay, got it. Thanks.
Okay, you're welcome.
Oh, and we just want to point out that after Cerner go live, the clerk will not have the ability to order any labs or diagnostic. It would fall on the physicians or the nurses.
Sorry, I have to clarify. It's not, they don't order it. I'm sorry. It's more like they arrange for the lab to come down. That's what I
Okay.
meant. Yeah, sorry.
All right.
Sorry, just one more question. Are nurses in clinic able to draw blood?
Yes, we can do if we need to. If the patient has a central line, a port, something like that, we can draw blood if we need to. Yes.
Okay. Okay. Excellent. Thank you.
Yeah.
Okay, I believe that's all our questions. Okay. Are there more questions from Richmond or from our design team?
Not at the moment. Thanks.
Okay, thank you.
Hi, it's Mary. I just wanted to, you said there's gonna be a scheduling one coming up soon, is that correct?
Correct.
Okay.
Yep, the scheduling one is
perfect.
coming on the 30th.
30th, perfect, excellent.
yeah.
The other question I had, it's, if the procedure was like aborted in between, like they're in the room and they discover patient can't be done. So, but the patient's already been given IV and everything. How would you discharge them? Is that the same process you have to go through post-op and then discharge? Even if they didn't get any meds, like, I guess that's.
If the procedure hasn't started and no meds are given, there are there are protocols and procedures to kind of discharge those kind of patients.
Okay.
Yes.
No, I just wanted to get an idea, but you know what?
Okay.
Probably when we go like.
Yeah.
And those will be better questions. For the
Yes,
nurses.
there
Okay.
is a step-by-step protocol for
Got
that
it.
kind of
No, that's good.
situation. Yeah,
Makes sense. Thank you, Tommy.
no problem. Yep, so the next scheduling session is on the 30th, and then the next design session for clinical, it's on July 10th.
Tommy,
Yes,
the scheduling session is not on the 30th. We're
Oh,
still
it's not?
trying to schedule it.
Okay.
It'll be sometime early July.
Oh, I see. Okay.
Yeah.
Thank you for the heads up.
Of course.
Okay, so if there is nothing else, thank you everybody for joining. We really appreciate it. And you might be getting further emails from us to clarify your work. Thank you, everybody.
Thank you.
Thank you.
Great day.
Thank you.
Thank you.